it's a great experience. It's very convenient, very easy for them, and very efficient, and actually saves a lot of money. I can't tell you how much I think I saved in terms of insurance costs by keeping people out of the emergency room, by keeping people out of my office or other specialty offices, and certainly as we've seen the curtailment of elective surgeries and other kinds of marginal hospitalizations. There have been huge savings relative to the cost of care. And certainly we don't want to see that go into intensive care hospitalizations for COVID infected patients. But I don't think you'll see nearly as much of that spent on that side of it as you will have seen savings. So in the same perspective, here it is a time when doctors are struggling. As I said, not only did my visits go way down, but of course I'm a pediatrician and a lot of my revenue comes from giving vaccinations and other kinds of office-based procedures. That's all gone right now, at least. We have to improvise. We have to really innovate and decide how we can do these things. I'm starting with drive-by vaccinations, but nonetheless, the opportunity to be able to capture some revenues is very important.